we are providing programs that get in really early, that aren't waiting for children to develop really significant emotional and behavioural problems, that we can provide some intervention that will enable children to develop successfully, both socially, emotionally and behaviourally.
So when we say think typical first, it's not about removing that person's disability from the equation, it's taking that into account, but it's looking at who the person is first and foremost and what their interests are, what their sense of character is, and looking at inclusive community groups that they can be a part of rather than identifying that person as having a disability, so belonging to a group of people because they have disability. It's about that level of engagement across a diverse range of people.
We encourage parents to start thinking typically as well, so it's not, oh, they can't do that because they have a disability. It's they can try it and we'll modify it just so that they feel comfortable.
We're a group of women who've all worked in mental health for our careers, who've got together to form a trust to allow us to raise funds so that we can work with families with young children in the Greater Wellington area, supporting those families to manage their children well and to build very positive relationships with them. So this program focuses on building a positive relationship with the children and helping the parents add to their tools of how to manage them and how to build a happier family altogether. Some of them come with their partner, some of them are single parents and come on their own. Sometimes people bring a support person with them.
So I work with a maximum of 6 families at any time, which enables me to meet them at least twice a week, so have that really close contact with the families. And I work with them for about 3 to 5 months, which is quite a short time, but it's a really intensive service.
What we want to achieve, not only to raise the awareness of problem gambling, but also to allow people to say and understand that it's okay to ask for help if they need to. On stage night, the children who have entered the competition and who will be receiving awards, we're seeing in the audience their mums and dads and their brothers and sisters and their extended family. So it's a family event that we're having tonight.
Local area coordination's point of difference is really that it's based on a social model, and it's about building sustainable relationships for people and making those connections for people so there's not such a reliance on service provision. We are there for when they wish to access us as opposed to us being imposing ourselves in their lives. What we're trying to do is phase our level of support out so that that individual is surrounded by natural supports.
We work under a restorative model, so people have choices. They make choices about what they want and how they need to be supported.
To get all the necessary support they require quickly so they can take control of their care in their hands.
I think the multisensory environment is unique too, because there aren't many in our area, or even in New Zealand, and it's providing a range of services for people in the mental health, the intellectual disability, the physical disability sector, covering all of those sectors.
Well, let's get into your outcomes meeting, David.
During the meeting, he will have whoever he chooses to be around the table to look at some of the things that he's done in his life, especially in the last 12 months, and we'll talk about things like his rights, his goals for the year, his natural support network, friendships. We also look at where he lives and if he's happy here. This meeting is to celebrate that and to look at the next 12 months and to support him in that.
So I support a client in reaching their goals along with family. We identify cultural needs and values and personal beliefs. So every day is different and it's wonderful to make that difference.